A very good afternoon to all of you, and today we will be dealing with some of the important anatomy cases which are asked and which are very important from the perspective of NEET PG, MBBS, as well as DNB and PG anatomy students. So, as far as the anatomy cases are concerned, here I will be going through across some of the types of questions which are asked and what are the various important aspects in anatomy, whether it is the regional anatomy, I mean to say abdomen, thorax, upper limb, lower limb, neuroanatomy, head and neck, or it is the embryology, or it is the histology, or it is the various other aspects of anatomy which we are dealing. So straight away, without wasting any time, what are some of the important things which a student should know? So here you are given a question. This is a question which is asked in anatomy. I mean to say image-based question, and these are the types of questions which are nowadays asked frequently in NEET PG, FMGE, and as well as in certain examinations, which we take stage examinations for MBBS students as well, what we call as the stages in the anatomy. So we just now adapt some innovative methods of checking the students' knowledge as far as their various modalities are concerned. So over here you are giving the image of a, I would say, head and neck region, in which we say that the student is studying anatomy of head and neck, and the area points to which there's an arrow which is over here, shown over here, and you have to say to which vessel it points: superior thyroid, lingual, facial, ascending pharyngeal. So as you can see, there's a red, I mean to say, vessel over there, which is preferably an artery, and the artery lies at the level of angle of mandible. And you can see that it is a bit of a tortuous course and what vessel it is. So as far as your anatomical knowledge is concerned, you are well aware of a tortuous vessel which lies at the angle of the mandible, and that is usually the facial artery. And the facial artery anatomy, that it is a branch of the external carotid artery. It lies at the angle of the mandible, and it gives various branches like the ascending palatine, like the tonsillar, like the superior labial, inferior labial, angular, lateral labial. I'm not concerned with that point over here. My simple point over here is a pointer, and this is a, I mean, it's a sort of a spotter, and you have to identify the vessel. So the vessel over here is facial artery. So other aspects of facial artery will be dealing ahead, but important. These are the types of questions which we expect you to answer. So this is a prototype of one question, and similarly you can be asked pointers about other vessels, other nerves, other important structures, muscles in anatomy, which are very important. So this gives you an idea what type of questions you expect in anatomy ahead. So as far as this thing is concerned, we move to the next question. The adrenal glands are shown. So this is the adrenal or the suprarenal, which lie on the top of the kidney. As you can see over here, this is the kidney and this is the adrenal. Which vessel does not supply the adrenals? Superior phrenic, middle suprarenal, branch of abdominal aorta, renal artery. Now, as far as the blood supply of adrenal glands is concerned, adrenal glands happen to be very important glands, frequently asked. And as far as the blood supply of adrenals is concerned, you are well aware of the fact that adrenals has got three vessels: superior suprarenal artery, middle suprarenal artery, and inferior suprarenal artery. And they are the branches respectively of inferior phrenic, abdominal aorta, and renal artery. So over here, you can see that this is a very twisted question, sort of a twisted question. So the first branch, the suprarenal, given is the inferior phrenic. It is not the superior phrenic. So this is a answer to the question. This is does not supply. Middle suprarenal is there, the branch of the abdominal aorta I mentioned, and the renal artery, which directly or indirectly supply the adrenal glands. So this is a bit of a twister, and the questions you can expect to come in a very twisted manner. So that is second thing which is to be borne by you in your mind. Now, a patient in medicine department was asked to do a CT scan. Posterior cerebral artery infarct was detected. So over here, there's a PCA infarct which is shown over here. So the PCA infarct is there, which is shown over here, and we have to say the patient would manifest as, what would be the clinical symptomatology of the patient? motor loss, difficulty in speech, auditory loss, mind blindness. So this question tests your ability to know the motor areas of the cerebrum. Where is the auditory area? Where is the speech area? Where is the motor area? So as far as the posterior cerebral artery is concerned, it is usually concerned with the visual cortex, area 17, area 18, area 19, Broadman's areas. So as far as the Broadman's areas are concerned, we are well aware of the fact that it supplies the visual cortex, and there can be various types of blindness which can occur as a result of infarct to the visual cortex as a result of posterior cerebral artery infarct. So there can be various types of blindnesses, and the word blindness and the mind blindness are a result of injury to the associated visual areas. So here the correct answer would be mind blindness. So this is also something which has been put deliberately just to confuse a student, but you have to know the types of blindnesses which can occur as a result of primary visual area damage, the secondary visual area damage, and word blindness and mind blindness are a result of damage to these associated visual areas. So that is very important. Now, image recognition. You might be given certain images, surgical, gynecological, ENT, orthopedics, and radiological, which are concerned as allied branches of anatomy. So, what is this clinical condition? So, as far as this clinical condition is concerned, I mean to say that there should be no confusion as far as your clinical skills of identifying anatomical surgical conditions is concerned, because you can see a huge, I mean to say, mass coming out of the rectum, and this is basically a huge rectal prolapse, especially in case of what we can see likely a male, and you can see a huge rectal prolapse with a sort of a bit of a induration erythema also. So if you are not able to identify, because you can just sometimes students say answers and create blunders like piles, hemorrhoids, or maybe say a vaginal prolapse or the uterine prolapse. But here you have to recognize that there's a big mass coming out of a rectum, a copyright image, and this is one of the surgical cases which we had in our surgical OPDs once I was doing surgery. So you have to remember that this is a question in case where you can be asked about the clinical recognition. So to identify images, to identify surgical clinical images is a very important aspect of PG and DNB examinations as well. Now, moving on to this clinical question, a 33-year-old has a spinal deformity as shown in the figure, and it is shown over here. So you can see over here, it is already shown as kyphosis. So the most relevant disease association will be Scheuermann's disease, Perthes disease, Preser's disease, Sever's disease. So this is basically kyphosis happens to occur in association with osteochondrites of the vertebra, and there is this disease which is given the name as Scheuermann's disease. So what does this question test? This question tests your ability to know the clinical aspect of applied anatomy. Kyphosis, osteochondrites of the vertebra, osteochondrites of the femur, osteochondrites of the navicular, osteochondrites of the different bones which exist there. So you have to remember these clinical conditions. And this is one clinical example in which you are given already a diagnosis of kyphosis, and you have to name the underlying disease process. So this is applied aspect of anatomy, especially asked from PG, DNB, and NEET-based image, I mean say, and FMGE image-based questions. So very, very important. Now, radiological assessment, as I was telling you previously. So this is what? What is this image? What does this show? So this shows the radiograph of the chest, wherein you can see on the right side the lung, the black shadow, and on the left side you are not able to see the lung shadow, a huge and a massive left-sided pleural effusion. The loss of costodiaphragmatic and the costophrenic angles not seen over there. So in here you can see the whole lung shadow is obliterated by the fluid, which obscures the whole lung field. So this is a massive left-sided pleural effusion. Ability of a student to recognize chest radiographs, orthopedic radiographs, radiographs of the bones, of the joints, of the ankle, hip, knee, and I mean, say wrist joints. They form a very important component of the anatomy and applied aspects. So to identify not only the normal, sometimes to identify some of the important things which can be abnormal as a part of anatomic pathology as far as radiology is concerned, you have to be well aware of that. Now, moving ahead. Now, this shows facial nerve and the branches of the facial nerve. And they ask you, what is this branching pattern called as? As you are well aware of the branching pattern of the facial nerve, once the facial nerve exits from the parotid and there are these temporal, zygomatic, buccal, mandibular, cervical branches, and they just give the appearance of the feet of the bird, which is given the name as pes anserinus. Pes means the feet and Anserina means the bird. So because of the peculiar pattern of the feet of the bird, which is seen over here, and especially important from head and neck and plastic surgery perspective, because these are the branches of the facial nerve which almost lie transverse to the face. So a vertical cut, a cut which is vertical, cannot be done. So this is something which any person cannot do as far as the surgery of the face is concerned. Any plastic surgeon, any refined surgeon with a good anatomical knowledge will always try to give transverse incisions, not vertical incisions, because one vertical incision can just destroy and damage all the branches of the facial nerve, all the pes and serenus. So this is, by the way, which came to my mind. But in addition, you have to remember these patterns, what we mean by cauda equina, what we mean by pes and serenus, what we mean by certain other terminology which exist in anatomy, which exist in surgery and related branches. So pes and serenus is the name given to the branching pattern of the facial nerve once it exits from the parotid. So remember these things. Now another question over here. A surgeon is operating on the stomach area and the vessel encounter. So this is an arrow and this is a vessel. So this is the lesser curvature of the stomach and this is the greater curvature of the stomach. And the examiner over here tells you which is this vessel over here. And this vessel over here is most likely the left gastric artery. The left gastric and the right gastric arteries are seen along the lesser curvature of the stomach in the lesser omentum. And what is lesser omentum? A peritoneal band connecting the lesser curvature of the stomach to the porta hepatis. So this important surgical concentration, once the surgeon is operating in the area of the lesser omentum, he has to be very careful about the anastomosis of the left gastric and the right gastric artery. And the left gastric artery is a branch of the celiac trunk directly. So this is some of the surgical concentrations as far as the anatomy is concerned. Expect these types of questions in your exams, and that's very important. Now, over here you see the importance of certain anatomic areas. What is the importance of the cribriform plate of ethmoid? What is the importance of the mastoid process? What is the importance of any other area like the clivus? What is the importance of the pituitary fossa? So these are some important areas. I mean, say the lateral wall of nose. What can happen if there is damage to these areas? So over here, the cribriform plate of ethmoid, you know about the olfactory nerve. The olfactory nerve, let's we just go in relation to the cribriform sieve-like pattern in the bone, in the anterior cranial fossa. So a damage to this area, a damage to the cribriform plate of ethmoid causes one clinical condition which is given the name as CSF rhinorrhea, in which the CSF trickles down the nose as a result of damage to the cribriform plate of ethmoid. In a similar manner, there can be CSF arteria, in which there is a fracture to the base of the skull. But over here, I am concerned with the cribriform plate of ethmoid, which is a very important thin plate of bone seen in the anterior cranial fossa, and damage to this trauma of any kind can lead to CSF rhinorrhea, in which CSF trickles down the nose, which normally should not happen, and that is very, very important. So these are some of the important areas which are asked from an anatomical perspective. So this is one thing. Now another question over here. This is a diagram, image-based question again given. what is the nerve palsy over here? The examiner will not say anything. It is just a sort of a flashcard type of a thing which can be placed on your table, and you are just asked to say what type of nerve palsy is this. Now we will get confused. There's no need of confusion. This is tongue, the I mean say lingua, and over here the tongue is deviated to the right side. Say for example, and the deviation of the tongue is ipsilateral, and you have to know the motor nerve supply to the tongue. I'm not talking about the sensory nerve supply to the tongue. So you can see the tongue deviated to the right side, and what it simply indicates the palsy of the nerve supplying the tongue, the palsy of the motor nerve supply to the tongue, the palsy of the hypoglossal nerve. So this simply is a question which you will answer like, sir, it is the 12th cranial nerve palsy because the tongue is deviated to the right side and the right hypoglossal nerve causes this sort of palsy. So on clinical examination, if you ask a patient to protrude his or her tongue out and he or she just cannot place it in the center and the tongue is normally deviated towards no side, it is normal. But in case the tongue is deviated to either to the right or the left side, it simply indicates respectively the hypoglossal nerve palsy of the right or the left side, as the case may be. So this is simply 12th cranial nerve palsy, right-sided hypoglossal nerve palsy. The question and the answer should be simple. Now again over here, the arrows are shown and you are asked to pinpoint what is this area. And as far as your profound knowledge of neuroanatomy is concerned, you should be very well able to identify that this area is the part of the hindbrain and this is the medulla. And in the medulla, you have got the pyramids and the olive. And the pyramids are formed as a result of pyramidal decussation because the right and the left sided corticospinal tracts, they just cross over in the medulla, and that is as a result of which you can see huge projections on the medulla because there will be the crossing in here, and these are the projections which we give the name as pyramids, just like the pyramids of Egypt. Not that huge, but overall they are given the analogy of the pyramids because they are more prominent than the other parts in the medulla. So that is what we say pyramids. So these are some of the types of questions which you are asked in your NEET PG, in your FMGE, in your MBBS. And what this thing, I kept the difficulty level very, I would say simple. These are level A questions. These are not level B or level C questions. I might be hopefully coming up with some higher difficulty levels, but this was just to give you a bit of an encouragement, just to tell you how are the questions asked and what should be your role and how you should prepare. And I think that if you have any queries, you can just, I have given my email ID. You can just write to me. You can just put your queries, and I will be more than glad to help you in any sort of help I can offer you. So again, thanks a lot for your time, attention, and I wish all of you best of luck. Thanks a lot.